Welcome to What Your GP Doesn't Tell You, the podcast for both doctors and patients with me, Liz Tucker. This week, I'm talking to dentist Dr Victoria Sampson, who argues that while the gut microbiome gets a huge amount of attention, funding and publicity, the oral microbiome gets almost entirely overlooked. Yet, as she explains, it is a close symbiotic relationship with our gut biome, so changing the composition of one affects the other. But perhaps most importantly, poor oral biome health is linked to a range of illnesses, from heart disease and Alzheimer's to diabetes and arthritis. And remarkably, even our fertility can be affected by the health of our mouth. But frequently, in all these conditions, isn't even considered as a possible cause or aggravating factor. So what can we all do to ensure that we have a healthy oral biome? But before we get to the details of Victoria's interview, a brief request from me. If you enjoy this podcast and would like to leave a review on Spotify or Apple, that would be much appreciated. It really helps. You can also become a paid supporter of the podcast at patreon.com/whatyourgpdoesn'ttell or via PayPal on my website, whatyourgpdoesn'ttellyou.com. A huge amount of work goes into both the research and production of this podcast. So even a small amount of money makes a huge difference. And you can find out more information about the pod on my website, where you can sign up for the podcast mailing list, follow me on Twitter at Liz C. Tucker, and on my Substack account, liz.tucker.substack.com. Many thanks. And now back to Victoria's interview. Dentist Dr. Victoria Sampson is a co-founder of the Health Society, a multidisciplinary clinic that focuses on balancing the oral microbiome, reducing inflammation, and stabilizing disease. Victoria says optimizing your dental health can directly impact the rest of your health. That's why she also works closely with a range of medical colleagues at the Society. Here's her interview. So Victoria, thank you so much for joining the podcast today.
Thank you so much for having me. It's my pleasure.
Victoria, hardly a day goes by when I don't read something about the importance of the gut microbiome, but somehow the oral microbiome seems to get far less attention. Why do you think that is?
Music to my ears, your question. That is one of the biggest issues, I think, because the oral microbiome is the second largest and most diverse microbiome after the gut, and what many actually say is an extension of the gut microbiome. But for some reason, everyone has gotten so obsessed with the gut microbiome and kind of abandoned the oral microbiome. And one of the issues with that is we spend so much money and so much time as a population, billions, on the gut microbiome testing, on probiotics, changing our diet, without people realizing that if they're not changing their oral microbiome at the same time, then actually they're just constantly going to be feeding the same bad bacteria from their oral microbiome into their gut microbiome by swallowing or breathing, or even through their blood circulation. I think the reason that the oral microbiome hasn't had the same limelight as the gut microbiome is because of the lack of research. If you look at how much research has gone into the oral microbiome versus the gut, it's quite little. And only really in the past 5 to 10 years has there been a lot more interest in the oral microbiome, in how saliva can be used as a diagnostic tool, partly because of COVID, and that really accelerated the research. But I think that now the time where people are starting to realize actually there's a thing about whole body health. And part of that is looking at all of the microbiomes. So yeah, it's an exciting time. Like the New Scientist, they just had a front cover of the oral microbiome and how important it is. New York Times is talking about how flossing can improve your risk of dementia and Alzheimer's. So
I did see that, but I did wonder if the New York Times hadn't slightly overstated the case.
They were a little bit maybe dramatic with their terminology. There has been a lot of research to show, particularly in the last 5 years, that having an imbalanced oral microbiome significantly increases your chance of Alzheimer's. And in one study, it was up to 70% higher chance of Alzheimer's just because of oral bacteria being able to travel and cross the blood-brain barrier and cause problems with neurons in the brain.
I suppose with all of these things, the question is it an association or a correlation? Because it might be if I've got Alzheimer's, I'm not very proficient at doing my teeth.
Yes.
I don't floss. It's quite difficult, isn't it, to know whether it's an association or a causation?
I completely agree with you. And for decades, we've all had the question, particularly dentists, of is this an association or a causation? And until we had definite evidence, we all were like, okay, it's probably an association and we're not going to do much about it. But actually, like if we use the Alzheimer's case as an example, we now know that there's direct causation linked there. You're completely right. If someone is to have Alzheimer's, their oral hygiene might suffer, and that might mean that they have, worse dental diseases. But actually, what they found was there's a specific oral bacteria called Porphyromonas gingivalis, and this bacteria is only found on the mouth, and it releases certain toxic enzymes called gingipanes. And these gingipanes are able to travel from the mouth up to the brain. They are able to cross the blood-brain barrier, and they were found in 70% of Alzheimer's sufferers in their cerebrospinal fluid. And these gingipanes were able to actually damage and disturb the neurons. They didn't find these gingipanes in patients who didn't have Alzheimer's. They only found it in ones who did. So this again is where you start seeing there is definitely some causation. I think, like, for example, the New York Times went a bit too heavy and said, this will cause Alzheimer's and you need to floss or else you might die. But, we know with Alzheimer's, it's so multifactorial. And a lot of the causes of Alzheimer's are not things that we can change. Like if you have genetic mutations, you can't do much about it. But actually, oral hygiene and having a balanced oral microbiome is one of those factors that you can change.
But generally, there seem to be a number of inflammatory markers which are important for Alzheimer's, some of which, for example, are affected by diet and exercise, which people can do something about.
But again, the oral microbiome and oral health has always been the one that people don't really think about. And I would argue is probably one of the easiest ones to sort out.
I suppose one thing that makes the oral biome particularly important is the fact that it's really our first line of defense against many diseases.
Yes, so it is the first entry point for most bacteria. Every time we breathe, we eat, we drink, even we kiss, we're introducing new bacteria into the microbiome. So the oral microbiome is one of the easiest to change, which can be an advantage and a disadvantage.
And there seems to be a clear link between the oral biome and a number of chronic health conditions.
Yes.
Such as cardiovascular disease.
Yeah, I would say there's kind of three different mechanisms of how the oral microbiome or the mouth is connected to systemic diseases. So the first one is what we call low-grade chronic inflammation. Let's say you have gum disease. Gum disease is essentially inflammation of your gums, and it's kind of a bacterial infection. You have high levels of bacteria which are destroying your gums, and the destruction of the gums releases lots of inflammation. And this inflammation actually is able to travel throughout the rest of your body and cause what we call low-grade chronic inflammation. So these are high levels of your interleukins, your CRP, all of them. And so if, for example, a patient is suffering from another chronic inflammatory condition, like they have rheumatoid arthritis, then this inflammation from their mouth is just adding petrol to the fire. It's just making their inflammatory condition worse. And there's a very strong bidirectional relationship with the inflammatory conditions and periodontal disease. So I've seen with a lot of my patients that when I treat their periodontal disease, their inflammatory condition improves significantly. Or if they go and get the right medication or the right treatment for their inflammatory condition, their periodontal disease improves as a result. So that's your first one. Your second is what we call metastatic infection. And this is the idea where bacteria from your mouth is able to travel throughout the rest of your body. Either you swallow it in your saliva, you breathe it into your lungs, or it travels through the blood from the gums. And this bacteria can travel anywhere across the body and cause infections elsewhere. So this is where we see there's something called infective endocarditis. A lot of patients who might be listening, maybe they've had like some sort of knee surgery, or they've had a big surgery where something has been put into their body. And a lot of the time they are recommended to not have a hygiene for 6 months to a year. And the reason for that is that bacteria from the mouth can dislodge and travel down to wherever the surgery site was and cause infection. So this is just one example of so many other conditions where bacteria from the mouth contributes. And then the third one is actually just damage to the blood vessels. So you've got the bacteria from your mouth, travels through to the rest of your body, and it releases these toxins, which can damage the blood vessels. And that damage to the blood vessels will mean that they can't dilate and constrict as well as they normally would. And this is where we see connections with things like heart disease. with high blood pressure, even with diabetes, erectile dysfunction. These are all because blood vessels are not able to dilate as they normally would. And so you have restricted blood flow.
And what happens if those diseases improve? Does it work in reverse too? If a patient's diabetes gets better, does his or her oral biome improve as well?
Yeah, massively. So you see a massive improvement in patients' systemic diseases through improving their periodontal disease. And there have been many times where actually I've maybe not done anything, but maybe they've improved their diet and their diabetes is under control. And as a result, their periodontal disease improves massively as well. So, for example, at our clinic, we have a functional medicine practitioner, we work with doctors, we do blood tests. And the idea is that we're putting the mouth back into the body. So a lot of our patients are suffering from lots of conditions. And a lot of the time, the mouth is the missing part of trying to improve their general health.
Because if you're saying there's a sort of symbiosis between the oral biome and the gut biome,
Yes,
if you treat one and not the other, then the problem will just continue.
exactly. So we do the opposite, where patients might be coming here and we do their oral microbiome, and we actually recommend that they do gut microbiome testing. There's been lots of studies to show actually that by doing even just a normal hygiene, so your professional hygiene at the dentist, can actually directly impact your gut microbiome and improve the diversity of the gut microbiome just from your 45-minute hygiene. So this is everyone's daily reminder to go and get their hygiene done.
And I think actually for many of us, even worse than the dentist is the hygienist. Not a reflection of him or her at all, but just the process.
Yeah.
Now, Victoria, you mentioned that one of the things you carry out are oral biome tests. What sort of information are you looking for?
Classically, there's a couple of oral microbiome tests on the market. Generally, they just are testing for bacteria. So they can look at absence or presence of certain bacteria that we know are associated with gum disease or with decay. And by knowing what bacteria that patient has, we can actually know how to treat their gum disease in a more personalized manner. Or if they have decay, why they're getting decay. There is a new test on the market at the moment, which actually tests not only the bacteria in your mouth, so the absence or presence of the bacteria, but also zooms out and looks at the diversity of the whole microbiome, as well as also looking at your genetic mutations, your diet history, your oral hygiene. And by collecting all of that data, it puts it into this algorithm or whatnot, and it's able to actually predict your risk of disease and also recommend what to do to reduce the risk of that disease in the future as well.
How much is this individual? And how much can you say that there are certain bacteria which will be favourable for most people?
So there are classic periodontal bacteria. So you've got maybe 20 bacteria that we definitely 100% know are causing your gum disease. Depending on which bacteria you have, then you can think about what antibiotics you might need, or even what mouthwash. So it could be that someone just needs to use a mouthwash for 2 to 3 weeks and it will get rid of the right bacteria and they go back to normal. But actually, there are 700 different bacteria in the oral microbiome, which make 2 billion bacteria overall. So it's a pretty diverse microbiome. And on top of that, to make matters a little bit more difficult, the oral microbiome is quite unique because it has lots of different locations or areas within the same mouth. So if you think about the bacteria that would like to live on your tongue or under your gums or on your teeth, they're all very different habitats and environments. And so that's why the oral microbiome is so diverse and there's so many different bacteria within the same mouth. And then to make matters even worse, we go ahead and we add crowns and fillings and dentures and veneers and all sorts in the mouth. And we add even more environments in the mouth where new bacteria can be introduced and grow.
But I'm interested that you say mouthwash, because I've heard others argue that the problem with mouthwash is it can kill off your oral biome, which presumably is not what you want to do.
No. So if a patient is not going to do an oral microbiome test, I generally recommend they don't use any mouthwash. If they're going to do an oral microbiome test and they find out that they have high levels of bacteria that hate oxygen, then we would recommend a mouthwash which releases lots of oxygen, and that would kill those bacteria specifically. So I see mouthwash as something that you should prescribe to a patient for a select amount of time to get rid of specific bacteria, but it shouldn't be used in replacement for your toothbrushing or your flossing or to freshen your breath. Because if you do that, then yes, you can cause damage.
One study's linked a particular mouthwash ingredient to heart disease due to its purported effect on nitric oxide production. Does that mean you recommend a mouthwash that doesn't contain that ingredient, or do you think the risk's been overstated?
I do recommend different mouthwashes just to be completely safe. The study has not been very, again, fantastically done. And I guess probably why you're doing your podcast is because there's so much research coming out and sometimes it's inflated and it's actually not very evidence based and people just don't know where to look or learn or go. So I, to be on the safe side, don't recommend the mouthwash, but I'm not completely against it. I'm just waiting for more research to look into it.
I don't usually use mouthwash, but during the COVID pandemic, several studies reported that over-the-counter mouthwashes appear to have the ability to inhibit early COVID viral replication.
Yes.
Typically ones containing cetylpyridine chloride, or CPC for short, and ethyl lauryl arginate, or ELA for short.
Yeah.
So really, whenever I went out into a crowded venue, I always used the mouthwash. And I know it's only N=1, but I stopped using it when the pandemic was slightly abating and almost immediately caught COVID. And of course, that may well just have been a coincidence. But even now, as we still have quite a lot of COVID around in London, if I go to the theatre or something, I'll still use the mouthwash for a couple of nights afterwards.
So actually, my whole journey started because of COVID, really.
Interesting.
I was involved in that research to do with mouthwash and with COVID. For me, my journey started because I thought patients who have gum disease have very similar risk factors to patients who are suffering the worst from COVID complications.
Sure.
I wrote a paper and a proposal to say, look, I think patients who have a more imbalanced oral microbiome or who have gum disease would be at a higher chance of having COVID complications and being in ICU. And so we went around to hospitals and we wanted to see whether or not this hypothesis was correct. But because it was COVID and we were in hospital, we weren't able to access these patients. We weren't able to do a checkup on them and see what was going on in their mouth. So instead, what we did is we collected their saliva and we did microbiome testing. And just by collecting their saliva, we were able to get this lovely snapshot of what was going on in that patient's mouth without even seeing them. And using that, we then created this research which showed that an imbalanced oral microbiome or having gum disease increased your chance of COVID complications by up to 9 times. So we then were like, okay, so what is happening? Why is this happening? And part of the reason was because patients were suffering from bacterial superinfections. So they get COVID, they are immunocompromised, they're going through a lot, and then they have terrible gum disease. And maybe normally on a normal day when they're healthy, that bacteria is not really doing much or isn't able to cause problem. But then when they have COVID, because they're so immunocompromised, that bacteria from their mouth is able to travel down to their lung and cause bacterial superinfections. And actually, the biggest cause of death in COVID was not the virus itself, but bacterial superinfections.
Well, it's interesting actually that I saw that Salisbury Hospital gave all COVID patients mouthwash just as a standard treatment.
Yes.
What you're talking about is gum disease, but what this was also suggesting was reducing the level of viral replication.
Yeah.
I was really surprised that it didn't get more publicity. I bought the Dentile mouthwash for £3 from Sainsbury's. Not a major outlay, and I made sure that when my mum, who's in her 80s, had it, that she used it 3 times a day. She didn't have COVID very badly. I don't know if that was a factor or not, but it just seemed such a simple thing to do.
I know, and that's what a lot of the things with the oral microbiome are so simple to do, but they just never really get the publicity that they should. And actually, out of all of the mouthwashes that we tested to reduce viral load, saline was the best. Essentially, it's salty water. And just by rinsing with it or irrigating through your nose, that had the best effect compared to the other mouthwashes.
Well, that's interesting. When I did have COVID, because I occasionally get sinusitis, I always have an irrigation bottle. So in addition to the mouthwash, I also used the saline irrigation several times a day. I didn't have COVID badly. Who knows if it made any difference or not? But again, I thought it's not going to do me any harm.
Yeah, but maybe the reason you didn't have COVID badly was because of that. We found that by using the mouthwash regularly whilst you had COVID, the extent of the COVID infection would be shorter and you would recover much quicker.
Now, for these patients who may be using mouthwash to kill off unhealthy bacteria, is there also a role for pre and probiotics in helping them rebuild up their biome?
Yeah. So at our clinic, what we do is we would often put a patient on maybe an antimicrobial mouthwash for 2 to 3 weeks. So we get rid of all the bad.
Get rid of the bad stuff first before you start introducing anything new.
Exactly. So we need room for the good bacteria to grow. So we get rid of the bad. And then after 2 to 3 weeks, we then put them on a different protocol with pre and probiotics. So we've got some toothpaste, which actually have prebiotics in them. Sometimes it's just food recommendations. And then probiotics, there's a whole lot of oral probiotics on the market. And that's something that patient can then use for life. It's maintenance and it works fantastically.
I think when it comes to pre and probiotics, there's so many on the market. People feel a bit overwhelmed. Do you have any thoughts on that?
Yeah, the big issue. I know a lot of companies which are trying to find a solution for this because pre and probiotics and just supplements generally are quite a unregulated industry. Anyone can kind of come out with something for wellness, and that doesn't mean that it's correct or it's right. So whenever I'm recommending something, we do a lot of research to make sure that it's the correct one. If a listener's out there and they're not sure what probiotic they should be taking or prebiotic, I personally prefer my prebiotics from my food. Your fermented foods, it's better to ingest it in that way. And for a probiotic perspective, you need to think of something which is not going to be destroyed by the stomach acid. So generally, these probiotics need to be activated by something as well. If your probiotic is a pill and sitting on the shelf for 6 years, that's definitely not going to be a good probiotic. The whole essence of a probiotic is that it's live, good bacteria. And bacteria is not going to sit there living for years on a shelf. So often, if it's on a shelf, it needs to be like activated. That could be by chewing it. It could be by mixing it with water, by shaking it, something. And that's often where the freeze-dried probiotic would then be woken up and then it can be effective. So I always look out for that. And then also trying to find something which is not going to be destroyed by your stomach acid. So sometimes they have like a covering of some sort as well.
I was really interested to see, we're not just looking here at diseases in the oral biome, but even things like fertility can be affected. And I think women with gum disease actually conceive later than women who don't have gum disease.
Yes, exactly. So there's been, again, a lot of research to show that having gum disease will reduce your levels of specific hormones which are associated with conception. And so patients who have periodontal disease conceive 2 to 3 months later than those who did not have periodontal disease. And then it's not even over yet. So let's say the woman is successful in her conception, is pregnant, then actually having periodontal disease whilst you're pregnant can directly impact your baby. So research has shown that patients who have periodontal disease, their children usually are born earlier. So they have preterm birth or they have low birth weight, preeclampsia. And this is because, again, a lot of bacteria are able to cross through into the amniotic fluid and cause disturbances during pregnancy. So they did a really interesting study in Malawi. And Malawi's got the highest rate of preterm birth and low birth weight in the world. I think it's 17%. It's pretty high. And so the country thought, okay, what can we do to reduce this in the cheapest way possible so all the women can have access to it? Thought, okay, let's recommend that these pregnant women chew sugar-free chewing gum with xylitol in it, and also to have some dental care done. And they split this group in half, good couple of thousand women. They split the group in half. Half the group didn't get anything, and the other half had dental care, and they were recommended to chew gum 2 to 3 times a day. And the group that chewed gum and had the dental care had a significant reduction in their preterm birth and their low birth weight. I think it was about 50 or 60%. And that's just from chewing gum. I mean, it's something, again, so cheap.
It's amazing.
Yeah, amazing. So cheap. And you've got the same for men as well. So it's not just women. Having subfertile sperm is strongly correlated with periodontal disease.
For the pregnant women, did they look at the bacteria in the amniotic fluid at all to see what was there?
Yes. So they found specifically Fusobacterium nucleatum, a couple of other ones, which again are really associated with the oral microbiome and nothing else. So now we have a lot of women who come to our clinic who are maybe on their journey of trying to conceive. and we'll do an oral microbiome test, and we'll try and make sure that they don't have any of those bacteria that are associated with delayed conception or preterm birth or low birth weight, and we get rid of those bacteria.
So there are a number of both health conditions and things like fertility, which perhaps doctors also need to be thinking about. Yeah, I'm sure only very few doctors would think about referring their patients to someone like you.
Yeah, it's been a journey. I would say more and more are opening their eyes and are interested in collaborating. And I think part of the reason for that is oral microbiome testing, because that is a language that everyone can really understand. So if you're a doctor, then you understand test results. You can see high levels of bad bacteria, high levels of inflammation.
It feels nice and concrete, doesn't it? Less woo-woo.
Exactly.
Than you saying, I think the oral biome's important.
Exactly. You can test your patient and say, okay, look, you've got all of these. You should go and see a dentist. So we're seeing a lot more doctors referring their patients in. And then from the patient perspective, it's also had a huge uptake because patients often don't understand what's going on in their mouth. And there's a huge issue with patients not trusting dentists generally.
It is a terrifying experience.
Yeah, I know. Some of us are nice, I promise. But part of the reason for that is that we speak completely different languages. So if I sit here and I tell you, okay, you have periodontal disease, you've got pocketing of 7 millimeters, and your frication is level 2, you don't get that. And if you don't trust me, then you're not going to do anything about it. And you're going to say, okay, she just wants my money, whatever. I'm going to come back in 6 months for my next hygiene. But if I did a microbiome test on you and I said, okay, don't listen to me, but look at these test results. You have high levels of really bad bacteria, inflammation, genetic mutations, then that's your body speaking to you. And you can actually track that and follow it and retest it and understand what your dentist is saying to you.
Yeah. So if we are trying to take as much preventative action as we can, I guess one of the first steps is the type of toothpaste that we use. Now, recently, when I was looking at changing my brand of toothpaste, I thought I must make sure it's not too abrasive. I currently use something called Ultradex, which is a low abrasion toothpaste, which was something that my dentist recommended. But I was really surprised by how many of the well-known brands are actually highly abrasive.
Yes, there's a lot of very abrasive toothpaste and toothpaste which have sodium lauryl sulfate in them. That's SLS, and it's a foaming agent. And these two things, I just don't understand why they should be in toothpaste ever. The abrasive aspect is really damaging to the enamel. The teeth are the only non-shedding surfaces in the whole body. And what that means is that unlike your skin or your hair or your nails, so let's say you exfoliate your skin every week, you have new skin growing. And so you're not damaging your skin. But if you are essentially exfoliating your enamel every single day with your abrasive toothpaste, slowly you're actually grinding it away and no new enamel is going to grow back.
It seems to me that a lot of the lower abrasion toothpastes are the more expensive ones.
That I don't know. I think it's really to do with the feeling. So if you have an abrasive toothpaste, it makes your teeth feel nice and I can't think of a better word other than slimy. It feels slippery and everyone likes to, lick their teeth and they go, wow, that was a great brush of mine. And I think that's part of the reason. It's the same with hygienes as well. So if you're going to the hygienist and they're polishing your teeth afterwards, that's also exactly the same thing. It's highly abrasive. It's damaging the enamel.
Well, actually one thing I was going to ask you, one thing that actually has always worried me with the hygienist is the abrasive material that they use to clean my teeth. Here I am carefully using a low abrasive toothpaste.
Yeah.
And then I go to the hygienist, and is this not causing me long-term damage?
The jury's still out as to whether or not it's going to cause masses of damage. But if you were to look at a microscopic photograph of the tooth before and after having a scale and polish, you can see that the surface layer of enamel is removed every time you have a polish. So there are other hygiene techniques out there now. So at our clinic, we use something called guided biofilm therapy. There are other clinics that do it too. And this basically is low abrasive, uses erythritol, which is the sister of sugar, and it's naturally antibacterial. So it coats the teeth, gets rid of the stains, and it doesn't damage the enamel at all.
Because there's that sort of paste substance.
Yeah.
And I always look at it and think, gosh, that just feels really abrasive.
Yeah, it makes you feel nice and it gets rid of your stains, but it's damaging to the enamel if you have it done too often.
I mean, the other toothpaste that I tried actually, which I did like, which was something called Swiss Dent. It was very expensive. I don't know if you've come across it.
I haven't, no.
It also contains coenzyme 10
Okay.
and vitamin E, and it's low abrasive. It just actually costs more than any other toothpaste I've ever used. But I thought it was actually really good. It doesn't sponsor the podcast. So you mentioned that we shouldn't have SLS. It's a foaming agent. It's something which is inflammatory and we don't need.
Yes.
Now, what about fluoride? Some people suggest that we shouldn't have fluoride in our toothpaste, but I suspect you won't be one of them.
It's a very controversial topic as to whether or not fluoride is needed in toothpaste. I'm in the middle, to be honest with you. I have a lot of patients who are fluoride free. It's your choice. And if you don't want to put something in your body, I shouldn't have to force you, but I should be able to give you an alternative to that so that you're not damaging your teeth or your health. There's been some research to show that high levels of fluoride can cause toxicity and neurodamage. But these studies are not very well done at levels of fluoride which are through the roof.
So way higher than you'd ever have in your toothpaste.
Way higher. This is you eating, 200 tubes of toothpaste a night and, swimming in mouthwash. It's a lot of fluoride to be having. So I don't really support those studies. What I don't believe in is fluoridating water. So that is putting fluoride in your water. And there are some states and some cities which have that in their water system. And I don't think that that is correct because you have no idea how much water people are drinking. Kids, they're a lot more susceptible. So that's what I don't believe in. But in terms of toothpaste, if you're going to go for fluoride toothpaste, that's great. Go for it. We know that it's extremely strengthening and remineralizing for the teeth. We know that if you have fluoride in your toothpaste, you reduce your risk of decay significantly. And if that's not convincing enough and you say, actually, I'm still scared of this issue of toxicity, then fine. But at least use a toothpaste which is highly remineralizing in a different way. So there are toothpastes on the market which have hydroxyapatite in them. And hydroxyapatite is meant to be very similar to your natural tooth structure. And so this is an alternative to your fluoride toothpaste. And I would recommend that to patients, but you need to be careful about which one you're using because, again, it's quite unregulated.
And there are a lot of so-called healthy toothpastes which contain things like ginger and charcoal, and there's not much evidence that those are effective in a toothpaste.
I hate them. Those types of toothpaste are my worst nightmare. And one of the issues with our clinic is that because we're very health conscious and maybe we're very different in our ideologies, we attract patients who are very anti-fluoride, which is fine. But because they haven't had maybe the support and guidance from dentists as to what fluoride-free toothpaste they should use, they end up using these toothpastes which have charcoal and aloe vera with essential oils combined up in some paste. And these patients are coming with decay on every single tooth. And the worst is the kids. So particularly in kids, we're seeing kids needing 8 to 10 fillings each.
Gosh.
And they're 6, 7 years old.
Yeah.
And I kind of compare it to sunscreen. So if you're not going to wear sunscreen and you're going out in the sun, like you're not protecting yourself. If you're not using a toothpaste with a remineralizing agent, you're not protecting yourself. So either you don't go in the sun, or in this case, you don't eat sugar, or you use the right protection.
And I'm assuming that at basic, an electric toothbrush is pretty much essential.
Yes, so we love electric toothbrushes. My favorite are your Philips Sonicare or your Oral-B IO8. Those are my two, and I'm not sponsored by either of them. But those are the best ones because they do have the work for you. A lot of research has shown that patients, when they think that they're brushing for 2 minutes with a manual toothbrush, on average, they're brushing 20 to 30 seconds. So by using an electric toothbrush, it times you, it does have the work for you. It's so much more effective.
Victoria, one of the things I've seen you say in the past, and I was a bit surprised, was that when we brush our teeth, we shouldn't use mouthwash at the same time. Whereas I've always thought, if you are going to use mouthwash, you've brushed your teeth and then the mouthwash enhances the effect of the toothpaste, but that's not the case.
No, so it's actually the opposite. So if you spend all this lovely time brushing your teeth and then you use your mouthwash, you're actually rinsing away all of the goodness that you've just spent 2 minutes putting on your teeth. And often they actually will counteract each other. So the ingredients in your mouthwash will stop the ingredients from your toothpaste working. So we always recommend that you use mouthwash either 30 minutes after you brush your teeth or before, or I like it at lunchtime. So, if you're at work, have a bottle of your mouthwash. You can have that after your lunch. And that way, there's 3 times a day that something is happening in your mouth. And whilst we're on this topic, also making sure you don't rinse your mouth with water after you brush your teeth. So a lot of patients always assume that they should brush their teeth and then rinse with water afterwards. But actually, what you're doing is you're rinsing off all the goodness. So you want to just spit out the residue and walk away. You want to keep the toothpaste on your teeth.
I think sometimes it feels slightly uncomfortable having sort of bits of toothpaste left on your teeth.
Yes, some patients hate it and say, oh, but how am I going to have my coffee and my orange juice and la la la. So I will meet in the middle and I will tell them that they can do it in the morning because it makes them feel fresh and happy. And in the evening, they have to leave the toothpaste on their teeth. Think of it as you're putting moisturizer on your face or an overnight mask. It's the same thing.
Now, I do always floss. That is one thing that I do always do. But I've got quite a small mouth and I've used every possible implement over the years, from the little kind of hoops, the little hooks. And I've always struggled to get right at the back of my mouth. Do you have any advice?
I would say there's little saw things. They're like little harps.
Yeah, I've tried those, but my teeth are really closely packed together at the back. I find it really difficult. And one of the things I did wonder about was a water flosser.
So water flossers are great. They don't replace the need for brushing or flossing though. And that's where some patients make the mistake. But water flossing is absolutely fantastic. Sometimes we even recommend patients use their water flosser and they put like a little bit of mouthwash in their water flosser to just deliver everything into the gums and on the teeth.
And basically, when we brush our teeth in the morning, we should also be flossing. We shouldn't just be flossing once a day.
It's dependent on the patient. I mean, the dream patient is brushing and flossing twice a day. To be completely realistic, most patients, when I tell them to do that, they'll brush twice a day and they'll floss once a day. And it's enough. I'll take it now.
And I suppose if you brush your teeth last thing at night and then again first thing in the morning, there shouldn't really be food caught in your teeth.
Yeah. So I would recommend that you floss first and then you brush afterwards. You should wait really 30 minutes after having a meal before you brush your teeth, just in case you had something maybe acidic or really sweet and sugary, and you actually end up grinding that into your teeth.
Now, quite a few people use tongue scrapers. They've always seemed a bit barbaric to me. Do you think they value?
I actually really like them. It depends on the tongue scraper. So if you're looking to buy one, try and get one which is metal. So you can get the copper or the stainless steel ones, which are Ayurvedic, and those are naturally antimicrobial. I hate the little brushes, sometimes on the back of your toothbrush and it's got some bristles and people start like scrubbing their tongues. That's terrible. One of the issues with tongue scraping or scrubbing is you have to be very gentle with it. If you scrape too aggressively, you actually end up irritating what we call the filiform. So you irritate the filiform on your tongue and they end up overgrowing. And so you might be doing it because you don't like the white or the funny colors on your teeth, and you're actually making it worse, and it will get worse and worse if you do that. So you need to be quite gentle. I would recommend, 3 to 4 times a week and using one of the metal hook ones, just very gently.
Now, I think we're pretty well aware that antibiotics are really bad for our gut biome, but presumably they're not going to do much for our oral biome either.
No, we've done a lot of oral microbiome testing before and after antibiotics for other issues. You've had, tonsillitis, and it does change your oral microbiome significantly. We prescribe antibiotics regularly in the dental practice as well. And so we put them on a protocol afterwards on pre and probiotics to just help recolonize their microbiome afterwards and get them back into a healthy state.
And how long would they be on that protocol after they finish the antibiotics?
About a month to 2 months. It's not bad. You could even do it for the rest of your life if you wanted to.
So I'm just wondering, for someone who hasn't done that and took antibiotics a while ago, perhaps last year or even the year before, is it still worth them doing that?
It can recover by itself. So if you do have fantastic habits, or if your body is actually quite good at responding to bacteria, then you might not need to go on that. So I wouldn't just automatically think, okay, I have to do this. I would get a microbiome test. I would see what's going on in your mouth and then decide thereafter. One of the biggest things with microbiome testing, and this is something I've kind of quite recently learned, and that's why I've developed a test for it. I was doing oral microbiome testing on patients, and I would get 2 patients who have exactly the same results. They have all the same bacteria in their mouth, but one patient would have terrible gum disease, terrible problems, and the other patient is completely fine. And the patient who's completely fine, they smoke, they drink, they brush terribly, but they have no problems. And this is where you start to see that genetic mutations and how your body responds to that bacteria is really, really important.
There are so many different factors, basically.
Massively, yeah. And so we can all have good and bad bacteria in our mouth, but it's really how your body responds to that bacteria. If your body is really hyperactive, it's super inflammatory, then it will release lots more inflammation than the average person. And you're at a higher chance of having gum disease than the person next door. So me, for example, I've done the test, obviously. And if I decided to pick up smoking and I decided to stop brushing my teeth, I would be at a much higher chance of gum disease than the average person because I have those genetic mutations that mean I'm very inflammatory.
Aside from the fact that it showed that you were very inflammatory, did your oral biome test show what you were expecting it to show?
I had low levels of good bacteria because I'd never done anything. I just brush my teeth normally. I eat well.
But presumably if you eat a healthy diet, well, perhaps I'm fooling myself, that my biome would be in reasonable shape, but not necessarily.
Not necessarily. It could also be from 5, 10 years ago, had a bad habit or you weren't taking care of yourself as well. And so the microbiome is just the same and no one's tried to change it. Also, some people are just born without the right bacteria. So if you look at childbirth, you can actually see that mothers, when they are giving birth, they actually introduce a lot of good bacteria and sometimes bad to their babies. And then breastfeeding, that again is introducing even more good bacteria to these babies. So I wouldn't assume that because you have a good diet and you brush twice a day, you would have all the good bacteria because maybe you weren't breastfed. Maybe you were born in a more difficult way. There's so many times that the bacteria isn't introduced.
And of course, the other factor in childbirth is the difference between a vaginal delivery and a cesarean. Because babies born via vaginal delivery absorb the mother's genital microbiome, whereas those born via cesarean don't.
Yes, exactly. And they're starting to play around with the idea of a cesarean.
Sort of swab the baby.
Exactly, and swabbing the baby. And then also vaginal microbiome testing before birth to make sure that the bacteria that you're introducing to your child is good bacteria and trying to control and measure that.
Victoria, seem to be a number of other products coming onto the market for biome health, such as probiotic chewing gum and pastils. Are you a fan of those?
Yeah, I quite like them. If you're going to be using chewing gum, at least use a chewing gum that's going to be beneficial to you. So we do recommend for quite a few patients like probiotic pastils, chewing gum, which has xylitol and green tea in it. It's not one size fits all. So we recommend it depending on what the patient's needs. So if a patient has a really dry mouth, then we might recommend that they suck on some probiotic pastils, they chew some gum just to increase their salivary flow. But I really like them.
Victoria, as you mentioned earlier, the world of supplements is really confusing. One day I can open the paper and I should be taking a certain supplement. The next day, a different paper tells me I shouldn't.
Yes.
So are there any supplements you think people should take to help their dental health?
So again, it's not one size fits all. CoQ10 is great. So you said that you had that in your toothpaste. I love CoQ10. So CoQ10 has been shown to be really great for the gums, for gum health. And if you were to ingest it, it's also great for oxidative stress and for your general health as well. Or in your toothpaste, it's going to be good for the gums. Your classic calcium, vitamin D, always recommend that you have it with K2 to increase the absorption, vitamin C as well.
Can I just ask you about calcium? Because that's been quite controversial. Some studies have shown increased risk of heart disease, particularly, I think, in postmenopausal women who take calcium, as opposed to getting calcium from the diet, which doesn't have that risk.
Sorry, I should have corrected that. So when we're recommending different things, I try and get it all through food if possible. So the red pepper has more calcium in it than, your normal supplement. So just eating those foods is much, much better. The ones where you would have to supplement it would be your CoQ10, your vitamin D, especially if you're living in London. So we started doing vitamin D testing in our clinic. So we have like point of care. So we get the result within 10 or 15 minutes. And I would say 95% of our patients are vitamin D deficient. And there's a strong correlation between vitamin D deficiency and periodontal disease. We'll test and then we will recommend the dosage of vitamin D either through an intramuscular injection or supplementation And that will help with their periodontal disease as well.
And I think one of the issues with vitamin D, if you look at the UK's NHS recommendations, many people think these are too low. There's the level of vitamin D to stop you getting, for example, diseases like rickets. But the level needed for a healthy immune system and good overall health, many argue is likely to be higher. And a lot of experts I talk to mention a level of around 4,000 to 5,000 international units a day.
Yeah. So you're completely right. The level that the NHS recommends is actually significantly lower than the level that is recommended in the rest of Europe. So we use the level that Germany recommends. We don't use the UK's recommendations because you're right. There's one thing to avoid getting ricket. And then there's one thing to actually start to see the anti-cancer effects of vitamin D and actually the contribution to wellness that vitamin D can have. And that is significantly higher.
Now, in this expensive toothpaste I have, the other thing that's added is vitamin E. Does that have any value for oral health?
Yeah, so more gum health. So again, it's great to be in your toothpaste. You taking the supplement isn't going to do that much.
Yeah. So Victoria, if you had to give one tip to everyone listening today about how to improve their dental health, what would it be?
Go get your microbiome tested. I would say that, honestly, I would. But if that's not something you're interested in, then keep it simple. Just brushing twice a day and flossing. It sounds silly, and your dentists and hygienists probably say it to you all day, every day, but you don't need to spend loads of money. You don't need to be really complex or anything like that. Just doing it properly and simply is usually the best way.
Really fascinating subject. Thank you, Victoria, so much for sparing the time to talk today.
My pleasure. My pleasure.
Bye-bye. Hope you enjoyed the latest episode of the podcast. And if you've enjoyed the show, if you could leave a review, that would be much appreciated. It really helps. Many thanks for listening. Bye for now.